Hello, everyone. I'm Dr. Kevin Yaudes from McNeese State University. I want to welcome everyone to the first of our Mental Health Monday, part of our Mental Health Monday webinar series for the summer for the University of Louisiana system. Today, I'm going to be talking about mental health. What do we mean? Okay, so a little bit about me. This year, I am the mental health content expert for the University of Louisiana system. I'm a faculty member at McNeese State University. I'm also a counselor. At McNeese, I am the assistant department head for the Department of Psychology, which as of July 1st will become the Department of Psychology and Counseling. In that role, I have clinical responsibility over two of our clinical programs. So of course, we have an undergraduate psychology program. We have a master's program in applied behavioral analysis and also a master's program in counseling that we are working on accreditation for. And the department name will change as of July 1st. And I have clinical responsibility over the clinical aspects of both of those programs. I'm also the faculty advisor for the K-Dory Counseling Clinic. I mentioned two clinical programs. Each of them have a clinic, a community attached to them. And as a community clinic, the Autism Clinic, we work with clients from Southwest Louisiana, and the same is true for our counseling clinic as well. And I'm the faculty advisor for KDCC. In the counseling clinic, the K-Dory Counseling Clinic, we also created a suicide education awareness program in 2019. I do a lot of work with suicide prevention education in Southwest Louisiana and also within the state. I'm a Louisiana State board member for the American Foundation for Suicide Prevention. That is the largest national nonprofit with suicide prevention, education, and research as a focus. And somewhat connected to that role, I'm also the co-chair of the Lake Charles Out of the Darkness Walk for the American Foundation for Suicide Prevention. This is a fundraiser. It's the largest fundraiser for the American Foundation for Suicide Prevention, the largest annual fundraiser, and we hold that every year in the fall. So that's a bit about me. All right, so what I'm going to do today is to talk about what do we mean when we say mental health. What does that mean? I'm going to break this up into a division that I've seen in the work that I do with other clinicians when we talk about mental health. We talk about mental health in some regards in regard to mental wellness or growth, but then as the conversation continues, it can become more illness oriented. And so I'm going to talk about that divide. I'm going to talk about the role for faculty, staff, and administration at university campuses. We'll talk briefly about the complexity of addressing mental health. And I'm going to also mention the Mental Health Advisory Council that we have created at the University of Louisiana system this year. The bones of it were created last year, but we solidified that, and I'll talk about that a little bit later. All right, so the divide. So one of my favorite quotes about mental health comes from Beck. This is not Aaron Beck. This is E.S. Beck. And as far as I can tell, no relation to Aaron Beck for those of you who might be familiar with psychology or with counseling. Mental health counseling is designed to contribute to the vitality and vigor and to the soundness in body, mind, and spirit and social connection that sustains well-being and so is considered by our society to be health. So I really love this quote. I think it captures the best of what we could be talking about when we're talking about mental health. And I will explain that on the next slide. The next few slides, I think next 4 slides, this information comes from the CDC. So when the previous slide comes from Beck, and again, I think is really in line with the way that counselors, clinicians think when they're talking about mental health. We're talking about it from a growth perspective rather than being illness oriented. So when I move to the CDC and we're talking about what is mental health, you're seeing a lot of similarities here. So you're seeing that mental health is psychological and social well-being. It affects how we think, feel, and act. Impacts how we handle stress, relate to others, and make healthy choices. and is important throughout the lifespan. And I think that's an important, a very important point. I think this is a point that sometimes gets lost in conversations about mental health. When we talk about mental health, many times clinicians talk about onset of mental illness, and for many of the major mental health issues like schizophrenia, possibly a personality disorder, maybe major depressive disorder, those things tend to have onset at about college age. So we're looking at 18 to 24 traditional college age, 18 to 22, 24, somewhere around there. However, mental health is important throughout the lifespan, and some examples of that could be retirement. For anyone attending this series, maybe some of you are retired, maybe some of you are non-traditional students and you decided to return to college, to university to receive a degree or another degree. When people retire, if a large part of their identity has been their career, that can be very unsettling. It can provide a source of instability in someone's life when their identity was tied to largely one thing, and now they have to consider who they are again at a later stage in life. If we continue with that beyond retirement age or not, if someone is physically ill to the extent where they need caregiving, that could be their own children. It could be caregiving in a facility. If they need caregiving in some way that clearly indicates that they're not able to physically take care of themselves in a way that they once were, that loss of autonomy can also put someone's mental health in jeopardy too. So it's important to really consider that when we're talking about mental health, we're not always talking to people who look like me or look like you, that we're talking about it throughout the entire lifespan. So you can see so far the CDC and the bullet points that I've indicated here regarding mental health are fairly similar to the Beck quote that I mentioned just a few slides ago. The one thing you're starting to see, though, is that growth, an idea, a concept of growth is missing already. All right. Why is mental health important for overall health? So mental health and physical health are equally important components of overall health. I think everybody listening would agree with that. And it's something that certainly clinicians talk about, that there is, we need this balance. We need this balance between mental and physical health. An example is that depression, if somebody has diagnosed or undiagnosed depressive disorder, it can increase the risk of many types of physical health problems like diabetes, heart disease, and stroke. Another example is that individuals who have been have diagnosed or undiagnosed schizophrenia often smoke. So there's that connection. Now, the research regarding that specifically indicates that some of the chemical compounds in nicotine can mimic some of the drugs that are used for schizophrenia. So people tend to find themselves to something that helps, even if what they're even if the coping skill is maladaptive. Okay. And I also want to point out too that the presence of chronic conditions like diabetes, heart disease, and stroke, and we'll get to this in a little bit too, can also increase the risk for mental illness. So what's very important to remember from this slide is that it's bidirectional. So mental health and physical health are equally important components of health in general, and they both impact each other. It's bidirectional. It's not one causing the other. So I think you can see from this slide that we're starting to go further and further away from growth. And again, for me, that's the divide. When we talk about mental health, clinicians, mental health professionals, people who work in behavioral health tend to talk about growth and wellness, but when we start to dig into it, we start to get further and further away from that. I do want to take this time to mention that any questions or comments, please put those in the chat at any time, and I'll be happy to address those at any time during this presentation. All right, can your mental health change over time? So the easy answer is of course, and it's variable over time. So when we're talking about mental health issues, mental health disorders, if we are talking about mental health disorders, for the most part, mental health disorders are episodic, meaning that it's an episode. And that is also encouraging too, because even though people talk about, for example, depression as someone having lifelong depression, typically mental health disorders are episodic and they can get better with treatment. Of course, there are certain disorders. For those of you who are also clinicians or work in psychology or counseling, you're probably familiar with the old AXIS system, which we don't use any longer since the DSM-5 came out. And what we would have typically coded on AXIS 2 are lifelong mental health concerns or lifelong concerns like personality disorders. But for the most part, mental health conditions are episodic and they can vary over time. Again, you see with the CDC biological, environmental, and social factors, and that's been consistent throughout the CDC slides and also the Beck slide from a little bit earlier. And so when demands exceed resources and coping abilities, mental health can be impacted. So this is an extremely important part for me. I mentioned that I do a lot of work with suicide prevention. And every now and then when I'm doing a presentation on suicide prevention education, somebody will tell me, usually privately after the presentation has concluded, ever kill myself. I would never think about killing myself. And they usually will provide the reason that they could never. And that's great. That's great. You know, that is the goal of suicide prevention education, is to make sure that people are safe. And however, what I know to be true is that that might be the case from where you are right now. And with suicide, and with mental health in general, I've found that you don't know what you might be capable of or somebody might be capable of given the right set of wrong circumstances. So in your daily life, your demands might not exceed your resources and your coping skills. You might have the coping skills to deal with whatever comes your way at work, at home, at church, maybe. However, if the next day you find out that you're having relationship problems with your spouse that you were not aware of, or you lose your job, and so your financial security has been taken out from under you, you might find yourself in a situation where your demands exceed your resources and your coping abilities. And so that's why this point is so incredibly important for me, is that it speaks to the bias that contributes to the stigma around mental health and around seeking mental health services. We, in order to have productive conversations about mental health and how to support people, we need to be able to put away that bias, step outside of our perspective, and be able to listen to somebody else when they're sharing their own personal story with us, so we can understand their situation from their own perspective and not from ours.
Hey, Kevin, we have a question from the audience. Dr. Mayo asks, have you found that faculty experience mental health issues the longer they stay in the academy and move up? And is there any research on teaching while experiencing mental health issues? And what does the literature say about possible coping strategies?
So those are all good questions, all good questions. I'm going to touch on faculty, staff, administration a little bit later in this presentation. I don't know that I'm ever going to answer your questions completely fully. I would encourage you, please reach out to me. We could have a more thorough conversation outside of this presentation. And the reason is, we don't do a good job, and I'm not talking about the University of Louisiana system, in academia. We don't do a good job in addressing mental health concerns for faculty, staff, and administration. Academia can be tough, right? And there are individual concerns, and again, I'll touch on this in a later slide, with maybe an adjunct faculty member who loves what they do, but their position is year to year. There can be different concerns with tenure track faculty members who are working to make sure that they can get tenure. Maybe in a situation where they don't have access to a lab or maybe resources that maybe a colleague does at a larger research university. So there is research on faculty, mental health with faculty. There's not a lot. And I'm going to also talk about the Mental Health Advisory Council. This is one of the things that I hope that we're going to be able to address with the Mental Health Advisory Council, which again started this year, but it will continue on beyond my year. And I'm hoping that this is something that we can address because it's not addressed enough. Again, not at the University of Louisiana system, but in academia in general. So I know I didn't give you a lot of specifics. I encourage you to reach out to me, but this is a concern of mine, and it's something that we're going to be taking on with the Mental Health Advisory Council. Okay. So how common are mental illnesses? And you can see from the first slide from the CDC where information from the CDC was largely in line with the Beck quote, which was all about growth, all about mental wellness, except it was missing information specifically about growth. But now here we are already talking about mental illnesses and how common are they. And I'm going to touch on why we tend to go in this direction. So more than 50%, this is from the CDC again. So more than 50% of Americans will be diagnosed with a mental illness in their lifetime. Now, that being diagnosed is important because we don't know about undiagnosed mental illness, right? And many people may go their entire lives with the signs and symptoms that would meet the criteria for a mental illness, but if they don't seek out help, if they don't seek out treatment, that will remain undiagnosed. So we know that about more than 50% will be diagnosed with a mental illness in their lifetime. 1 in 5 Americans will experience mental illness, and that's in a given year. So that speaks to the difference between incidence and prevalence. And so incidence is this is used not just in behavioral health, but also physical health as well. Incidence is the number of new cases of something, maybe a mental illness, in a given time frame, and that given time frame is usually a calendar year. And prevalence is the proportion of a population that has something, maybe a mental illness, over time. 1 in 5 children will experience some serious mental illness. 1 in 25 Americans live with a serious mental illness, and these are the mental illnesses that you tend to see on TV and film. They're the big ones. I will also say too that TV and film does bear some responsibility on regarding stigma toward mental illness and stigma toward seeking mental health services for mental illness too, because when we see mental illness on TV, we typically see the big ones, right? We see schizophrenia, we see bipolar disorder, we see major depression, and they don't always get it right. And so 1 in 25 Americans will live with a serious mental illness, but the understanding of what that means for that person and what that looks like for that person, and let's be honest, sometimes how dangerous that person is. There's an idea that mental illness can be dangerous, and it's usually associated with these big ones. A lot of this comes from TV and film. So that's how common they are. What causes mental illness? So lots of different factors, some that we're going to talk about. I'm going to mention today are adverse childhood experiences. I'm sure many people in attendance today are familiar with ACEs. This also came from the CDC. Tons and tons and tons of research on ACEs, adverse childhood experiences. There's a number of versions of the ACEs survey that examine adverse childhood experiences. And by that, what we're talking about is any experience in childhood 0 to 17 that is potentially traumatic to the individual. Tons and tons of research on this from the CDC, and then many researchers outside of the CDC, of course, as well, indicating any number of correlations with trauma in childhood and mental illness, mental illnesses, but also physical disorders as well. So in a nutshell, the more adverse childhood experiences someone experiences up to the age of 18, that's going to increase their likelihood of smoking. That's going to increase their likelihood of diabetes or cancer. Okay. If anybody is interested in learning more about ACEs, adverse childhood experiences, you can just Google CDC ACEs, and you're going to find a wealth of information. Chronic medical conditions can also lead to mental illness like cancer and diabetes for reasons that I think that many of you can imagine. So a cancer diagnosis a cancer diagnosis maybe 50 years ago, 60 years ago, was generally seen as we're talking about the end of somebody's life. That's not the situation anymore. Types of cancers have treatments, effective treatments, and although I think oncologists still don't like to talk about the word cure, many survivors of cancer do talk about uncured. However, the challenges that come about with something, with a chronic medical condition like cancer and diabetes can lead to mental illness. And of course, one of the mental illnesses that you might imagine would be one of the depressive disorders. So dealing with cancer is considering your life and the possibility of the end of your own life, but it's also interacting with your sphere of influence, maybe your family, work. How do you negotiate? I need to use a significant amount of PTO or leave time to get the treatment that I need, and then it can be also with other groups as well too. A diagnosis like cancer or diabetes is draining in any number of different ways, including financially too. So I don't think it's a surprise to anybody that chronic medical conditions can lead to mental illness as well. Biological factors. With biological factors, I like to point out to my students, my graduate students, that there's not, when we talk about biological factors, that's really kind of an umbrella term. So we could be talking about genetic predisposition, but it's also could be maybe like with thyroid disorder, something that is hormonal too. So biological factors is a larger term that can easily be broken and down into other sub-factors as well. Substance use can lead to mental illness. I think for me too, there's that bidirectionality again. So mental illness could also lead to substance use as well. Feelings of loneliness or isolation, huge contributor to mental illness. Again, many of the depressive disorders. And as I've mentioned, I do a lot of work with suicide prevention, and loneliness and isolation are two huge risk factors for suicidal thought and behavior. So once again, you see that we are moving further and further away from a growth mentality regarding mental health. So let's go back to mental wellness. So all of the previous slides, I think there was 4 or 5, I got that information largely from the CDC. From mental wellness, it was a little bit harder to find this information. And so this information I got from the Global Wellness Institute. And so what I want to do is go back to a growth mentality and to really talk about the divide that I see when we talk about mental health. So mental wellness, an active process of moving from languishing to resilience to flourishing. Okay, so there's that growth. And that's the type of growth, for those of you who have taken a class or two in psychology or counseling, that Maslow talks about, right? That Rogers talks about, that Seligman talks about. All of these individuals were giants in their field, and talked about with Maslow, Rogers, and Seligman. Although some of them weren't necessarily counselors, they all fit within the disciplines of psychology and counseling, and they all talked in their own way about aspiring to growth, aspiring to be your highest self, your best self. Mental wellness is not a static state, which is very similar to mental health. So a few slides ago, we were talking about the variability of mental health. Same thing is true with mental wellness. It sounds like I'm saying the same thing, but I'm not. So somebody could have diagnosed depressive disorder, is seeking help, counseling, therapy, maybe on medication management for the disorder as well. And during that time period, they could still have days where they are feeling a sense of mental wellness, right? So saying that mental wellness is not a static state like mental health is not saying that these are the same things. It's a lifelong process. It's proactive strategy to strengthen emotional, psychological, and social resources. And once again, there is the emotional, psychological, and social aspects of mental health, of mental wellness. Mental wellness is about prevention, and it also moves us toward a deeper, richer, and more meaningful human experience. And once again, for those of you who are familiar with Maslow, in particular, Maslow's hierarchy, I think many people are familiar with that. At the very top of his pyramid, his hierarchy, is self-actualization. And he indicated that he did not believe that most people would achieve self-actualization, but it's maybe more aspirational for many people, where they are their best self, they are their highest self. And so that's what mental wellness is. And hopefully on our best days, that's what mental health is too. So with mental wellness, and again, contrasting it to mental health, there does seem to be a focus on, when we talk about mental health, we want to talk about mental wellness. We want to talk about growth. We want to come at this from a growth perspective, but we end up many times talking about mental illness, mental disorders, mental health issues. And I think that's problematic when we're having these discussions. However, I will say that when we tend to focus, or when we come down to mental health disorders, that's sometimes where we can get the outcomes, where we can develop a plan of attack for addressing mental health in a positive way. So I do think that in these disciplines, psychology and counseling, which are new disciplines, they're not chemistry and physics, which have thousands of years of research and thousands of years of researchers weighing in on what these disciplines are. So psychology and counseling are fairly new. And so I'm hoping that we can help provide a little bit as we move forward, so that when we talk about mental health, we don't immediately go into, here are the problems. All right, so role.
Kevin, before you move on, we have one more question.
Okay.
Could mental wellness be developed from a positive framework as opposed to a deficit model?
Yes, absolutely. Absolutely. And, I think that's where I'm hoping that the fields of psychology and counseling will go in the future. I think we have to do that. I don't think that's where we are right now, though. And as I just mentioned, one of the, although I do think we need to flip the script and come at mental health from a wellness perspective, I don't think we're there yet as disciplines. I don't see it yet. Although we've got a number of living researchers like Martin Seligman, I believe, is still teaching at UPenn, who are moving in that direction. I just don't think we're there yet. I will say, I think I can probably best answer that question through suicide prevention, is that I've given this a lot of thought with the work that I do with suicide prevention education, because it's not, when I'm doing a presentation or a training, it's unlikely that many of the attendees in those trainings wake up in the morning and think, what am I going to do today? I think I'd like to attend a suicide prevention training. However, nonetheless, they're there. And I find that until we can close that divide between mental health and or a mental illness and wellness, and flip it so that we're focusing mainly on coming from a wellness perspective, suicide prevention for me has been a tool to address mental health and mental wellness in general. One of the things that I say to my graduate students is that if you can sit with somebody who's a client who's talking about killing themselves, thinking about killing themselves, and you can do that with competence and with good outcomes, then you're probably going to be okay working with clients with a variety of issues, and some of those issues may. And I don't know if I directly answered your question. My opinion is that I think we can get to a point where we're addressing it from a wellness perspective, but right now, I just don't know that the disciplines are in a place where we can necessarily do that. Sometimes when we find ourselves focusing on the issues or the problems, if we keep that mindset that what we want ultimately is wellness, then I think that can come through in any training or presentation. All right, so roles. What role do we play? And what we're talking about here is what role do we play is I'm talking about faculty, staff, and administration right now. And so I've got a few journal articles that I believe will be up on the University of Louisiana System LMS on our Moodle page. And they should be up, I think, by the end of the week. And I've gotten some of this information from a number of different journal articles. So what role do faculty, staff, and administration play regarding, and right now I'm talking about student mental health. Inside Higher Ed did a student voice survey, and I believe it's something that they do on a yearly basis. It was conducted from Inside Higher Ed, also with College Pulse and support from Kaplan. And one of the things that they found was that 56% of students had indicated that their mental health is fair or poor in the last year. So that's a very large number, right? And I won't go into all the reasons, but you can imagine the reasons. College is hard, university is hard for students. And many times the students may be working full time in order to be able to afford college. Maybe they have a family. When I talk about this with colleagues here at McNeese, I will sometimes hear very vocally, I sometimes hear very directly that mental health is not my profession. I'm not comfortable with this, and this is not something that I can do as a faculty member. In other words, support or address the mental health of my students. What I always say, and I think any clinician would say, is that if we're talking about the mental health of our students at our universities, we're not expecting anybody to be a therapist, not expecting that at all, not expecting anybody to be a clinician. And even if we don't feel this is part of our job or our role, we're going to get it anyhow, right? We're going to get it through email. We're going to get it through a phone call. We're going to get it during our office hours because students will share with you what is going on in their lives. So it's not a call for everyone to be competent as a para therapist. That's not what anyone is asking. But I think what I'm hoping that, again, the Mental Health Advisory Council will be addressing is what is the role of a faculty member. In my opinion, it's to listen and know the resources on your campus, and possibly know the resources in your community beyond the counseling center on your own individual university campus. All right, so I've already mentioned what role do we play, listen, and know resources, be able to share resources. I've got a little bit more to say about resources later on too. I'd like to add set aside bias. So there's stigma around mental health. There's stigma around seeking mental health services. And what we have to be able to do is set aside whatever bias we have. And again, with my counseling students, I always make sure that we tell them that counselors have biases too. All counselors have biases. We need to be aware of them so that they don't play out in somebody's session, and so that we can be a competent professional. So as a faculty member, one of the things that I try to do is also set aside my biases about whatever a student is talking to me about. And many times, and I know that there are other faculty members on in attendance today, some of those, one of the biases might be our belief that you're not spending enough time on this class, you're not hitting deadlines. That may be true. That may be true, but coming into a conversation with a student with that bias in mind will be less productive than if we can try to set that aside and just listen to them and provide the resources that they need. So what about faculty, staff, and administration? So I told you that I had a slide or two about faculty, staff, and administration. And with mental health, university campuses, the conversations are typically around students. And I get that. And we do need to have conversations about how are we supporting our students regarding their own mental health. However, faculty, staff, and administration have concerns as well. I mentioned earlier that there's certainly stigma in academia. Not just academia, but there is stigma in academia around mental health and seeking mental health services. And that stigma is one of the contributing factors to that is the idea that that faculty, staff, and administration should be tough enough to be able to do what they need to do their jobs, right? The other part of this is that conversations around mental health regarding faculty, staff, and administration, we don't have them. We might occasionally have a conversation about what are we doing for faculty, what are we doing for staff, what are we doing for administration, but these conversations are largely absent in higher education. This is another topic that I'm hoping that the Mental Health Advisory Council will be able to take on at some point during this year. I'm not saying solve it, but take it on so that we can begin to have a discussion at a university system level and also starting on individual campuses too about how are we helping, how are we supporting our faculty, our staff, and administration when they're dealing with something tough. COVID comes to mind, of course, right? COVID comes to mind. Many faculty members who had never conducted a class online were suddenly doing so. They had no choice, nearly no choice, right? And then we all live in the state of Louisiana. And in Southwest Louisiana, I can tell you the past couple of years, in addition to COVID, have been extremely difficult regarding weather-related events. Here in Southwest Louisiana, we had a direct hit from Hurricane Laura. 6 weeks later, Hurricane Delta, the ice storm that everybody knows about from Texas, we were impacted as well. We had historic flooding in May 2021, and then 2 rounds of tornadoes. Series of tornadoes over the course of, I think, about 4 months. That wears on us, right? That wears on us, that wears on our state, that wears on our faculty, staff, and administration. Another part of the conversation will be that there's not a one-size-fits-all approach to mental health with anyone. And so when we have these conversations, we also need to consider adjunct faculty, tenure track faculty, female faculty and staff. I was just having a conversation recently with somebody about the challenges of being possibly a female faculty member, maybe in STEM. These things need to be considered. Faculty and staff of color, international faculty, and then of course administrative support staff in general. So I'm going to come right back around to mental health conversations. We need to start having these conversations about what are we doing for faculty, staff, and administration, what are their needs, and that is something that we're starting to do with the Mental Health Advisory Council. So complexity. All right. So bear with me with this one. I know I've got a Rubik's Cube up here. And so this Rubik's Cube, I've got an analogy. So with mental health, when I talk to people about mental health or about suicide prevention education, we want things to be simple. We want to narrow it down to, whittle it down to one thing. So with suicide prevention, about 90%, a little bit more than 90% of people who die by suicide have a diagnosed or undiagnosed mental health disorder at the time of death. However, it's never just one thing. And that's why mental health is very complex, is because we as humans, we want simple answers to a really complex construct like mental health. And that's just not really, it's not possible. So I've come to think about the complexity of mental health is like a Rubik's Cube. And you can see here, it's not a traditional one. It's not 3 rows and 3 columns, but I needed some additional rows and columns. So starting at the bottom row, I see this as, if we're talking about higher education, we're talking about a university or university system, we're talking about the bottom row, administration, staff, faculty, and students. This is just you. This bottom row is just you as an individual person, okay? The middle rows are spheres of influence. So maybe the next row up is work, your sphere of influence with work. So it's your impact and the impact you have from your office environment. Maybe the next row up is family. Maybe the next row up is church, or maybe you are sport that you participate in on a regular basis. So these middle rows are your spheres of influence, okay? And then the top row for me is systems. So like a university system, a hospital system, a school system. So the very bottom row, again, is your specific role as a specific individual. And then spheres of influence are something that will you interact with on a very regular basis, likely for years and years and years, if not decades. The top row being systems are like a hospital system or a school system might be something that you interact with on a time-limited basis. So maybe if you're a parent, you interact with a school system until your kids are out of school, and then maybe you don't interact with that school system again, maybe until you become a grandparent. So my point is, when we're talking about mental health, interacting with systems, interacting with our spheres of influence, and interacting with our role at a university, our specific role, what impacts our mental health in any given day is impacted by all of these things. Our specific role as maybe an administrator, maybe everything's going really great at our family, so that's an area of support for our mental health at that time, but maybe we're having a really tough time with our work sphere of influence. Maybe we're not interacting with a school system at the time, but maybe we just had a surgery a month ago and we're interacting with a hospital system in a way that does not benefit our mental health. So if you take these 5 rows and these 5 columns and mix them up as one would do with a Rubik's Cube, you can see that our mental health is impacted by our individual roles, by the spheres of influence that we engage with on a regular basis, and the systems that we engage with over time for specific reasons too. And so mental health is variable because we're going to interact with all of those things in different ways on a daily, weekly, monthly, quarterly basis. So mental health is complex. Again, that's one of the reasons that I see that sometimes when we talk about mental health and we come at it from an illness orientation rather than a wellness orientation, I do think the disciplines will figure that out over time. But right now, if we tend to skew toward illness orientation, like suicide prevention, I can see us also providing a benefit with mental health, even when we're focusing on something, what's wrong here. Okay, so mental health is complex, and we need to remember that too. Then we're not going to have simple, easy answers. That would be great, but it's just it's too complex of a construct in order for that to be possible. So the Mental Health Advisory Council that I've mentioned now a couple times. This is a collaboration of campuses in the University of Louisiana system. So all 9 of our universities have members on the Mental Health Advisory Council. We have our next meeting tomorrow. We're not looking to recreate the wheel, so we're leveraging what is already used, what already currently works. We're creating a climate where mental health is discussed and supported. And we're aspiring to creating a feeling of connection so that individuals can feel connected on their own individual campuses, all 9 campuses, and also to the system as well. So products. So I've been leading up to products the whole time. So again, when we're talking about mental health, yes, we should be coming from a wellness, a growth perspective. We don't always, but that's something that I think we can work with. So if we're looking at mental health occasion from what is not working, it can lead to products, things that we're producing in order to increase mental health, in order to focus on growth, in order to focus on wellness as well. So Mental Health Mondays webinar series is one of those products from the Mental Health Advisory Council. Talk Saves Lives. This is a suicide prevention training that is provided by the American Foundation for Suicide Prevention. We're getting ready to roll that out. It's going to be a free training, free to every one of our universities in the system. We're getting ready to roll that out and train people on each one of our campuses to provide this training on your campus. We are also going to be supporting an existing training that some of our universities use, which is QPR, Question, Persuade, and Refer. I'm trained on QPR. I'm also trained on Talk Saves Lives. They're similar in that they're both basic trainings on what to do if you're talking to somebody who is indicating directly or indirectly that they're thinking about ending their life. So they're both great trainings. They take about an hour, and we're working on training individuals on each campus. Individuals of concern will sound familiar to some of you at some of our universities in the UL system. This is a 2-page PDF that it's not an algorithm, but it works in a similar fashion. It needs to be made specific to your university, but it can provide some guidance about what to do in certain cases. Like, what do I do if a student tells me that they were sexually assaulted? What do I do if a student is talking about they're distressed about not being unsure about a career? What do I do if a student is indicating that they're thinking about killing themselves? And so it gives some guidance. Again, it has to be made specific to each university, but we will be working on that Mental Health Advisory Council as well. Mental Health Conference. We did have a conference planned last fall. I believe it was August and September, and but Hurricane Ida made it not possible. It was not possible. So we're looking to have a mental health conference this fall for the university system, and we're working out the details on that. Resource list I've mentioned before on a couple of different slides. One of the other initiatives for the Mental Health Advisory Council will be to have each campus come up with a resource list, not just for their university, but for their community as well. We will share that in the Mental Health Advisory Council, in a Mental Health Advisory Council meeting, so we can see what other universities have come up with as well. For example, one of the things that I think about when I think about mental health, mental wellness for students is food. If you are working to pay for school, and maybe you're paying for school entirely on your own, and you're living in your own apartment, paying your own car note, car insurance, maybe is a concern. So maybe knowing what community food bank is available might be beneficial to students. And then we're also looking at creating individual university mental health advisory councils, and we're going to pilot that at McNeese starting in the early fall. So that is the end of my presentation. I'm just going to quickly, I think we've got a little bit of time for Q&A too, but I'm going to just put up this slide that indicates the upcoming Mental Health Monday webinar series on July 11th. We're going to have Dr. Kayla Allison, who's going to talk about mental health in the Black community. On July 18th, we're going to have Gina Rossi, who is a clinical social worker and also has a long career in the military, decades long. I'm going to talk about mental health in the Hispanic and Latinx community. On July 25th, Megan Goldbeck, who is the Regional Director for the American Foundation for Suicide Prevention for Louisiana and Mississippi, is going to present Introduction to Supporting Those at Risk. That is a suicide prevention training. And on our final date, August 1st, Kathy Landreneau is going to present mental health in LGBTQIA+ community. So again, the series this summer, the way that we've constructed it is it might seem like we're focusing on problems. And I hope, given my presentation today, you will see at least why I don't see it that way. I think that identifying issues is a call to action, and I'm hoping that we are meeting that call. The other thing that was very important to me for this webinar series is that putting aside our bias. And so if I am unaware of cultural components of mental health for some of our student community, it may be harder for me to respond in support for students. So that's how we've constructed our webinar series this summer. All right, so that is the first webinar. So thank you. There's my email address if you'd like to get in touch with me. Are there any questions or comments?
Kevin, we did have one more question from Dr. Mayo. Are administrators' stigma of mental illness in the literature addressed nationally? And what have you found regarding Louisiana, if anything, specifically?
Okay, so that is a great question. You're asking great questions. And so what I've generally found, and my research with mental health in higher education, is that it's a touchy subject with administration and mental health. And so I don't see tons of good research on what's going on or how to address it. Many of the journal articles that I've seen regarding administration response to mental health are generally narrative. And so I'm not seeing data. And I'm a scientist, so I need to see some data, and I'm not seeing that yet. One of the reasons, again, that I go back to that with psychology and counseling, I think, we're new disciplines, and we have more yet to contribute going forward in the future. So again, don't have a lot to respond regarding your question, but I would like to say that with the Mental Health Advisory Council that we've created at the University of Louisiana system, I think this is the start of really something great, hopefully, for each one of our 9 university members, so that we can have these conversations and we can come up with specific solutions. I have seen situations where, and I've only seen it at large universities where there are centers for mental health for faculty. And I'm not talking about just a counseling center. I'm talking about a center for resilience or center for wellness. And again, but I've only seen these at large universities that can afford to have these types of institutes. And so it's not a situation where it's just a place for faculty, staff, administration to go receive counseling, or just to address wellness in general, but it's fairly holistic and fairly comprehensive. But again, the only places that I've seen those is at very large universities. Any other questions, comments? Thank you all for attending today, our first Mental Health Monday, and I hope that you will all be able to attend the 4 Mental Health Monday webinars that we will be hosting for the remainder of this summer. Thank you.